afternoon and welcome to today's lunchtime session at the Governors for Schools conference. This session is Monitoring Wellbeing with BounceTogether. My name is Lydia Bauer and I'm the Marketing and Communications Manager at Governors for Schools. For those who are visually impaired, we'll be sharing a brief verbal description of ourselves. I am hosting today's session and I'm female, white British, late 20s with long blonde hair and I'm wearing a black dress. Before I introduce our speaker, I've just got a few housekeeping notes to run through. Okay, so closed captions are available. You'll just need to turn these on yourself if you need them. The speaker, Bob, has been invited to share a short verbal description of himself, which he will do shortly. The chat function is disabled, but you can enter any questions using the Q&A panel, and we'll get to those at the end of the presentation. The session is being recorded. We'll send out links to the video on Monday to everyone that registered for the event with follow-up information as well. Please do continue to follow the conference and like and share our content on social media. And if you could use the hashtag GFSConference21 so we can see what you're sharing, that would be much appreciated. And finally, if you could complete the post-session survey, just to let us know how we're getting on, we'd really appreciate that too. Thank you. So today, leading today's session, we have Bob Wilkinson, who is Managing Director at BounceTogether. BounceTogether is a business specialising in cutting-edge software to help schools effectively measure and improve wellbeing and mental health. BounceTogether provides schools with a survey platform for measuring and monitoring physical and mental wellbeing and the attitudes of pupils, staff and parents. Their aim is to use their platform not simply to collect data, but to use that data to make a difference for every individual. Bob himself has spent over a decade in EdTech, working with thousands of schools across the country in the process, and we're really delighted that he's able to share his expertise with us today. I'm sure lots of you will have questions to put to Bob, so as I said, please post these in the Q&A and we'll try and get to as many of them as possible after the presentation. And on that, I'm now going to hand over to Bob. Thank you very much.
Thank you so much, Lydia. Really appreciate it, and it's great to be here as well. So just for my description, I'm Bob Wilkinson, a white male in my early 30s with short, light brown and grey hair. And I will say as well, thank you so much to Lydia, to Hannah, Matt and all of the team for asking me to talk today about a subject that we're so passionate about. So as Lydia has already explained, we're a business and a company that specialise in mental health and wellbeing survey software for schools. And we've been supporting hundreds of schools to effectively monitor and measure wellbeing in their own settings. So I'm just going to share my screen and then we can kick off. Let's try that again. Super. Okay, so this is what we're going to be talking through today. So first of all, we're going to start looking at talking about, generally speaking, wellbeing in education and just set a little bit of context around that. We'll look at sort of why some of the drivers for that, why things have changed in recent times. We'll then look at a whole school approach and one framework that actually many schools are implementing and are implementing around mental health and wellbeing. We'll then look at the role of measurement and the role that specifically data plays within that and how that can support decision making and how that helps identify priorities in a strategic fashion, leading through to how you can create and implement a systematic approach to wellbeing. And I'll hopefully share some tips, some tricks and best practice along the way. So just to start, really, this graphic really just kind of paints a little bit of a picture and illustrates I guess some of the pressures and the emphases and the demands that are put onto schools and teachers to support the emotional well-being of pupils and staff. And I think you'll agree that this is a growing subject and something that's actually everywhere. And really just this infographic shows that how schools are put under so much undue pressure around these particular areas. So if we take an example of the curriculum, and I always refer back to when I was in school many decades ago now, there was nothing on the curriculum around this. And I feel that one of the drivers for that is probably because we didn't know as much around that as we do now. So if we take the brain, for example, and the science and research that's surrounding that, we actually know more about the brain and have found out more about the brain in the last 10 years than we've ever known about it. So I think that's one of the kind of massive reasons that this is becoming something that's more cutting edge and more talked about, because we know more about it ultimately. I think it's really interesting as well that, you know, some of the stats on screen here, 64% of parents believe that the well-being of their children is more important than their academic attainment. And also the Department for Education, they've actually committed to putting more funding into schools, and actually positioning senior mental health lead training to all state schools by 2025. So some real drivers and some real fantastic movement around this space, which I think is going to make a big difference for us, everyone ultimately moving forward. If we take a look at some specifics around pupil wellbeing, there's lots of more research, and actually research that's coming out all of the time to support, I guess, ultimately two things, and two the main sort of key points that I want everyone to take away today. So first of all, the most powerful predictor of adult life satisfaction is a child's emotional health. This was actually done by a study from the London School of Economics and Professor Richard Layard. And he actually studied this in 2012 over a number of years, and found that the strongest predictor of adult life satisfaction is a child's emotional health. I think that's fascinating. And I guess just to kind of cut that a slightly different way, what we're actually saying is that if children are more emotionally healthy in their childhood, then they are more likely to be happier as adults and happier in society. There's a lot more research coming out to support this notion that whole school initiatives and whole school wellbeing strategies are actually having more positive impacts on academic outcomes. And there's lots of research that kind of supports that notion and the linkage. And I think it's something that we all know and we all feel, but there's more science behind that and more research that's coming out to support that. So I guess ultimately what I'm saying within this is that if our children and young people are more emotionally healthy, then not only are they going to be happier as adults, they're actually going to achieve better in terms of their academic outcomes as well. And then in the case of staff wellbeing, now teacher, there are some real stark and staggering statistics around staff attrition in schools. And it always seems to be a problem and always seems to be on the rise. I think this slide really just kind of paints that picture and some of the concerns surrounding that. Now, clearly, we know that the energy and the mental health of teachers impacts the quality of their teaching. Won't come as a surprise to anyone. But I think what's really clear is that, you know, teachers with the amazing job that they do, they should be and need to be given a lot more support and resources than they currently get, so that ultimately feeds into the pupils and the way that they go about things in the classroom. And I guess the key takeaway from this is that staff and pupil wellbeing, they really go hand in hand. You can't have one without the other, and you need to be supporting both. And I suppose that leads us into the next conundrum, which is, in order to do that, you know, there are many things that you need to do in order to do that successfully across a school and across a community. That's exactly where, and I want to introduce you to a whole school approach to mental health and wellbeing. So we've just looked at many of the kind of catalysts that results in schools implementing and taking more of an interest, I guess, in developing these strategies and developing a whole school strategy. But we're going to explore this now and look at what that means. And then we'll talk specifically around our expertise, which is measurement of wellbeing as well, and how that integrates and how that sort of complements and supports. So this is one, so what do we mean by whole school approach? Well, this is one way to do that, basically shown on screen. So I guess simply put, a whole school approach to mental health and wellbeing is a strategy where all aspects of school life are working together effectively. lots of you are probably familiar with many of the things shown on screen and these types of concepts, but this is an overarching framework. This one is actually provided by the Carnegie Centre of Excellence for Mental Health in Schools at Leeds Beckett University, that thousands of schools have adopted. Public Health England and the Department for Education also have their own sort of framework as well. And I guess it helps and supports you to develop a whole school approach and a strategy for how you can work with external agencies like CAMS. It helps you identify gaps around policy and how you can implement leadership strategies, effective leadership strategies, and self-audit your pupils and staff as well for support. And I guess last thing to say on this specific whole school framework is that it's evidence-based, and that means it's proven by science to work, certainly in the case of this one from Leeds Beckett University. And research has shown that a whole school approach is one way to get results and to drive improvement around all of this, which I think is one of many reasons why many schools are looking to implement this and take this up. So I guess the next question to ask is, why do we monitor, and why is there an interest in measuring well-being within this type of strategy and approach? So I guess somewhat controversially, I'm going to say that the approach that we just looked at provided through Leeds Beckett University is evidence-based, so it clearly works. So if we know that it clearly works, you might ask, well, why do we need to measure that? Because we already know it works. And it is a valid question, but I guess the two actually work in tandem and work in harmony. So this isn't a prescriptive approach to doing this in school and implementing this. It's a framework, and that means that it should be molded around the unique aspects of your schools and the unique challenges that your school is facing. And a whole school approach is a strategic thing. It's within that continuous improvement cycle. One of those is displayed on screen. But I guess what that means is that it fits within a system that enables you to continually improve what it is that you're doing. So this is, for me, the reason why measurement is so important within this. To enable each sort of aspect of that and each component to work effectively, you need to audit it, and it needs to be continually monitored so that ultimately if it's having the right impact or not. And I guess generally speaking, we just live in that world now where we monitor things. And generally speaking, we do monitor the things that matter to us. Every school has a duty to measure academic outcomes in the form of exams. Outside of education, we measure climate change, and we've measured climate change since the 19th century. We monitor lots of things around that, like the levels of CO2 and carbon dioxide gas in the Earth's atmosphere and the Earth's temperature and so on. And we do that because we can actively monitor it, and so that we can see that, well, what is going on, and are these changes that we're putting in place actually making a difference, and what difference are they making? Clearly, I'm not here to talk to you today about climate change. But I suppose where I'm trying to go and what I'm getting at is that if your aim is to improve mental health and well-being, then you need to be measuring it. So here are three things. There's many benefits to measuring well-being, but here are three things that it will enable you to do when you have implemented or when you are implementing a whole school strategy and a whole school approach. So I guess the first thing is none of these, some of these might not come as a surprise to anyone, but monitoring what you are doing. So it can help you understand, and it can help you learn about your own school, about your pupils and the staff and their feelings. Secondly, for impact. So it enables you to demonstrate the impact that you're making. And that's what Ofsted will want to see ultimately, in terms of having evidence to support what you have done. And I think it's often a lot easier to justify things if you've got quantitative information to demonstrate and to use that with. So, perhaps you're wanting to prove the impact of an intervention because you want to justify the funding for it again, or you want to justify additional resources for something. It will be much simpler to do that if you've got evidence to back that up, and if you can actually tangibly demonstrate some information around that. And then lastly, and I don't think this should be underestimated at all, it really helps to paint that picture and to, we live our lives in stories, we read stories every day, and they're often gripping, and having data and by measuring wellbeing enables us to tell our own stories around that as well, and actually enables us to showcase the great things that are happening and the great things that we're doing as well. So next I want to just to play a really short video from one of our schools. And Alicia on the video says some very humbling and complimentary things about BounceTogether and our product. But I wanted to share this because her comments are really centered around measuring wellbeing and the impact that it's had in their school. So I'm just going to share this video. It's only very short.
We are very good at our school. We know this is one of our strengths, of identifying children who are struggling with social and emotional needs and putting in interventions for them. But what we've never been able to do, and this has been a problem across all schools I've worked at, is measure the impact. So, for example, doing forest schools with the children, we use that as our communication intervention, but proving that doing that for a school session for 6 weeks with our specialist teachers, proving that actually has an impact on the communication or the well-being or the self-esteem of the child, has been the holy grail of forest school, really, because we know it works. We know for some children it's just absolutely the best thing for building them up, but we've never been able to prove it. And when you're having to talk to your governors and you're having to talk to your head teacher about budget and why we need the learning mentor to do more hours, or we maybe need to appoint a new member of staff or a specialist staff, this has become a way of proving their worth, really. We know they are, but you've got to prove it. I would absolutely recommend you do it. I think I've been in education a long time, and it is the thing that's missing. We all know it's not just buzzwords. We've known for a long time in education that children's mental health is absolutely crucial to everything else that's going on. And we know that there's a lot of money invested in interventions across different schools that help children, but being able to measure it means that you're able to prove that it works. And that's something that's been really hard to do in the past, but we now have a tool to actually prove that it's working. Yeah, it's very easy to access, very easy to use for children and for adults, and it allows you to see and have a really, really detailed insight into what your children are thinking and feeling about themselves, and then allows you to do something about it.
Brilliant. Well, it never gets old for me to hear such positive words from Alicia, and I do want to go on record and say thank you to her for recording that video for us. So let me just jump back into the PowerPoint. Okay, great. So we've looked at why, I guess, it's a good thing to be measuring well-being, and hopefully I've convinced some of you that it is a good thing to be doing that. We then looked at, and we did look at a whole school approach and how measuring kind of fits into that context and some of the advantages of that. We're next going to discuss, and I want to just take the remaining part of this talk today to just discuss some of the practicalities on how you can implement this and how you can adopt and create your own systematic ways of measuring well-being. For some of you that might not be as familiar with this concept, you might be thinking, where do we start with this, and how am I going to find the time to do that? So that's really what I want to sort of break down and show you how easy, but also how valuable it can be to do that. So this is what I'm going to take everyone through, and it's one approach sort of split up into 4 really simple steps and sections that we're going to talk through. I'll talk through some best practice and some things to think about when you're looking to implement this in school. Maybe you're already doing this already. You might just be able to pick up some things from this. But we feel that this is a really effective way to measure and monitor emotional well-being. I suppose one thing to say here, we will touch on some other bits around this, but when I'm talking about measuring this, I'm talking about measuring subjective well-being. So how the individual feels about themselves, as not how other people perceive them. So that's kind of what we're looking to get across here through using surveys effectively. So step 1, planning and purpose. So this is, don't underestimate this step. This is one of the most important steps throughout this sort of methodology. Once you've identified your purpose for measuring, a lot of the other steps that proceed will fall into place. A lot of schools don't know where to start with this. A lot of schools ask us for advice on where to start with this. And this is arguably the most important thing that you can focus on. If you get this right, the remainder of the things that should also follow suit. As part of setting and I guess defining your purpose, challenge yourself and ask yourselves questions. Why are you wanting to measure well-being at all? Why is that important to you? What are you hoping to learn throughout the process? And I guess think about what's led you to this point. What has made you want to measure well-being, and what are you trying to achieve? There's typically there's 2 really common sort of reasons, I guess, and purposes that schools measure and monitor this. And some schools refer to this as a temperature check, or running a benchmark, a sample across the school at regular intervals. We call it a temperature check. But it's basically a survey that you can run at several points of the year, so that you can understand and take general temperature readings of how your pupils and staff in some cases are doing. The other reason is around actually tangibly measuring impact of specific interventions. So if you're wanting to take a reading before you implement an intervention, and then after, thus demonstrating the impacts that intervention has made, so that you can do it again or not. As part of this sort of step in this process, you'll want to consider your audience and anonymity. And again, your purpose will kind of drive your audience. If you're measuring for impact, then it will be really clear of who you're wanting to engage. I suppose one tip around that, if you're running a particular intervention, a targeted intervention with sets of pupils, what can be really useful is if you also run or have a control, what they call a control group in place, so that you can actually see the differences between those who are having and going through that intervention versus those that aren't. So that can be really useful as part of that process too, with a control group. Next, you'll want to think about actually going about your practicalities of running your survey and capturing. It doesn't have to be just a survey, which we'll talk about, but the actual capturing of the data and how you go about doing that. So a big portion of that will be around how you go about selecting a questionnaire to use. And again, understanding what it is that you want to measure will help drive what measure you will be looking to use. So are you focusing around resilience? Is it something around emotional intelligence, or self-esteem, or empathy? There's lots and lots and lots of surveys out there for each of these topics. I know that I've spent years researching, reading, and looking at them. What I would say is that ideally, in an ideal world, you do want to use something that is validated. So a validated survey or questionnaire. And basically what that means is that it's been through a process of validation and testing. It means that the measures, the questions have been, they've been phrased in the correct way. It's been researched. And ultimately, our recommendation is to use validated surveys, because it then means that the information you're getting back from that and getting out of that is reliable. I've actually put a link on screen as well. It's a page on our website where we organise measures across, there's 60, in excess of 60 surveys that we have, spanning 12 different kind of categories, if you will, of that sort of emotional well-being spectrum, which is over 1,000 questions. And the majority of them are free to download in paper form as well. So do check that out as a starting point, because that can be a really useful resource if you're kind of looking at measures to use. You know, we've kind of created this library of them, if you will, for appropriate audiences, for separating them by key stages and that kind of thing. I would say I'd recommend looking at the questions as well, so that you can understand, you know, before you run a survey, look at the questions so that you can get a sense of, are they going to tell you what it is that you want to find out? So that can be a really useful thing as part of sort of planning and getting ready to start capturing the data. I suppose within that as well, it's kind of useful to just bear in mind that you might start measuring well-being, you know, that's assuming you're doing this over a long period of time. It's going to change. You know, you might use one measure, but then next year use a different measure, and so on and so forth. That's absolutely fine, and that's all part of your evolution of measuring and monitoring this sort of stuff. So, you know, don't let that put you off. Timing and environment. Now, this is a really interesting and important point in my view, particularly around timing. I do think it's very important to maintain consistency when you run those surveys, you know, particularly further on down the line, where you'll be wanting to make comparisons either throughout the school year or one school year versus another, and so on and so forth. If you're comparing results of surveys at just different points in the year, then it's not going to tell you as much. You know, for example, if you were running a survey based around you know, stress, for example, in and around exams, and comparing that to you know, a survey that you might have run in spring or summer, then it's going to be very, very different. So when you're looking at comparisons of results across multiple years, just make sure that the timing has been considered as part of that. As well, within that, the environment. So you know, make sure that pupils have got somewhere to complete the survey that's in a nice environment, and somewhere that they feel comfortable and are able to you know, respond to these questions confidentially. Just make sure it's not an example. It's really important that the pupils don't feel that it's a test, because it isn't. And then lastly, as part of this is to give consideration to the system and the method that you use to collect the data. I always say to use the right tool for the job. You know, critically, use a system that helps and enables you to get as much of this done in as quick as amount of time as possible, because ultimately you want to be looking at the results of these surveys that you've run, not too bogged down about thinking about, you know, confidentiality and GDPR and all of those different things. Use a system, you know, like BounceTogether, that takes care of all of that sort of stuff for you. And then step 3. So once you've actually collected your data, looking at the results and doing the analysis on the results, this can sometimes be a bit an intimidating process. So just wanted to take you through a couple of things that might help. So first of all, make comparisons within the data that you've collected. You know, don't just always look at the top line. Filter it, look at different year groups to see how they compare. You know, look at results in different categories and across different demographics, like SEND, like pupil premium, free school meals, etc. You know, it's really useful to see the data down to those levels, and it might actually give you something unique or something different compared to the overall picture. In some cases, you know, if you've got a lot of data that you've collected, an overall picture might masquerade problems with certain groups or certain demographics. So just kind of consider that as well when you're sort of looking at the results. Again, having a tool that enables you to do that is really advantageous at this point. And as well, within that, compare to, if you can, compare data to benchmarks and compare it to national benchmarks. So that's another good reason of using validated surveys, is that for some of them, they do have benchmark data. So the ONS life satisfaction questions, for example, you've then got something relative to compare your results against. Also consider capturing other data outside of running surveys on emotional well-being. So quantitative data, that information we capture typically through surveys for this purpose, they are incredibly valuable, but do consider factoring in other data as well. What I mean by that is you might want to think about running focus groups with a small set of children. We've had a lot of schools tell us that that's been a really effective thing to do. One thing around that, if you are running a focus group, don't run that with children who want to be part of the focus group. Pick a random mix and a random sample of pupils. And then lastly, as part of this process, discuss your results. And what I mean by that is to share those key findings, share the takeaways with your colleagues. If it's appropriate to, ask them what their take on the results is. Do they feel like there's any hidden surprises in there? Is it in line with their expectations? Ask your colleagues for help on this as well, where appropriate. So step 4. So fantastic. You've surveyed well-being. You've identified strengths. You've identified weaknesses, and you've engaged lots of people. You've engaged people in the planning and the decision-making process. Now it's time to put down a plan and put that plan into action. In my opinion, there's arguably nothing worse than running a survey and then not doing anything with the results. I have spoken to a school it was a number of years ago who ran a survey, and the results just got locked in the drawer because they were so intimidated about actually looking at the results. Don't do that, because you run the risk of doing more harm than good. As part of the planning and planning next steps, decide, make people responsible for this. Decide who is responsible for delivering those various actions. Set timeframes around that. Make them timeable. Give them a deadline. And ask for the support from your colleagues on this as well. Maybe set up a team or something like that, for example. You might even want to engage the pupils as part of this process, again, where that's applicable. In a lot of cases, the pupils will have the answers and the resolutions to the problems that you're looking to solve. One of our partner schools told me that something that came out from one of their surveys was that the pupils didn't feel like they were being listened to. So one of the pupils actually suggested to set up a small group, which moved into what they refer to as a pupil parliament. And it's great. They now feel like they're empowered and they have a voice. So engage people where relevant, because they might be able to help put those solutions and support you in actually acting on your plan. So many positive actions can come out of measuring wellbeing. One of our schools recently told me that their results were revealing and, I'm reading this, extremely informative. I've heard so many stories of pupils that from schools that thought their pupils were fine, but actually the results did say otherwise. Consequently, because it's come through as part of this process for them, they've been able to put things in place to support those pupils. And lastly, last but not least, measure again and continue to do so in line with your plan and what you set out to do. Maybe you measure well-being 3 times a year. Measure again when you say you're going to. When you've collected several data points, if you're running kind of temperature-based surveys, then you'll be able to compare those subsequent surveys against each other. So you've got those benchmarks. So that'll be really, really useful to help you monitor it and to help you, build that picture over the course of a school year. And I suppose lastly as well, don't be put off and don't worry if your results go down or if wellbeing levels go down. Wellbeing changes. It's not something that is a static thing. I'm sure everyone agrees with that and gets that. It can be impacted by so many different things. The important thing within this is that you're aware and you're keeping your finger on the pulse with what's happening and what's going on. So that's it from me in terms of the presentation. So hopefully now we've got a little bit of time to go to some Q&A if we've had any questions.
We have indeed. Thank you very much, Bob. That was a really interesting presentation with lots of takeaways. So we have a question from Daisy, and she's asked, often surveys in schools are generic as opposed to being targeted to the school. So how can schools incorporate a school-specific survey to the generic one led by the Federation or the Department of Education? Yeah,
it's a good question. I'd guess I'd go back to a couple of the points in the presentation, really. That you're inevitably going to want to mould the uniqueness of your school around those questions. So whilst you might have surveys that are kind of mandated and things like that you need to run, you can still create your own, and you should still be able to create ones with your own questions, or indeed use validated questionnaires that are out there as well that we've sort of talked about. So I guess I would say that consider timing within that if you're kind of going to run surveys in conjunction with one another, because you don't want to sort of cause survey overload and that type of thing. So I guess you just have to look to plan that out strategically so that you can make sure that one survey isn't encroaching over another, and there's sufficient distance between the two surveys and that kind of thing. But assuming that they're not mandating lots and lots of surveys that you're having to do, then I'm sure that would be able to be fit in somewhere, and it would arguably be more valuable because that's going to be local to you and something that you've chosen to do is something that opposed to that's mandated.
Great, thank you. Another question just about, could you define what well-being means? What would your definition be?
Yeah, well, I guess everyone kind of has their own definition of well-being, don't they? There are different organisations. In fact, there are actually books that have been kind of written on the matter and sort of have their own interpretation. But I guess when we refer to well-being, we just sort of like to think of it as simply how our mental and physical health is functioning, I guess, on the whole. I suppose when we talk about our mental well-being or emotional well-being, we're generally referring to our happiness, to our positive state of mind and feelings concerning our emotions. So I guess that's how I sort of look to describe it typically.
That's great, thank you. Okay, one from Rebecca. Where should a governor best input or request information to staff wellbeing before it's deemed too operational and not in the governor remit? So in order to have a whole school approach, that means it's not just about children's wellbeing measurement and monitoring.
You just repeat that again, sorry, Lydia, I'm not sure I understood the question.
Sorry, so where should a governor best input or request information to staff wellbeing before it becomes too operational and outside of the governor remit? And that's, yeah, we'll just do that.
Yeah, I'm not really, can you just say that again? Sorry, I'm not sure I'm understanding the question.
Sure, I mean, we can always send Rebecca a follow-up afterwards as well, if we can get some more detail. Where should a governor best input or request info into staff wellbeing before it's deemed too operational? Obviously the governors deal with the strategic things, but if we can take that offline and I can send Rebecca a follow-up afterwards.
Yeah, okay, no problem.
Sure. Okay. Quick question about the stats that you mentioned at the beginning. Are they COVID related? Do you know?
Well, there's a couple of stats. So if I just sort of flip through the presentation, I have references for all of these actually. So some were taken from, if we talk about pupil wellbeing, looking at studies, looking at predictors of life satisfaction in adulthood and that kind of thing. That's longitudinal stuff that's been done prior and pre-pandemic. The Teacher Wellbeing Index is from 2019, so again pre-pandemic. So I guess I've answered my own question there in saying that yes, they're kind of pre-COVID.
Okay, that's great. One from Alistair. in a primary school, how do you shape survey questions that would fit a 5 to 11-year-old to get a consistent view of wellbeing across the whole school?
Yeah, it's a difficult one, particularly with early years and Key Stage 1. So I guess our area of expertise is around the technology that we put into schools and work with them on. And I guess it probably won't come as a surprise that children between the age of 4 to 6 don't have problems in using the technology. The issue is that that sort of age, the child mainly reflects on their feelings in that moment. So if they've been upset or someone said nasty things to them, that will be reflected in their answers. It's kind of when the child is around the ages of 6 to 7 that they're able to think more holistically about the experiences that they've been having and felt over a period of time. There are surveys out there for younger age groups in Key Stage 1 and actually have commonality between them. So if you look at the Kindle scale, for example, that is actually almost a harmonized survey that's applicable for multiple different age ranges and groups, and the questions between that have been harmonized as well, so that the idea being that you can make comparisons effectively between each of those groups. A number of the questionnaires as well that we have that are kind of part of our bank and product, they span across multiple different key stages and age ranges. Like the Sterling Children's Wellbeing Scale, for example, it's a really well-known holistic wellbeing scale used in schools. That sort of spans across multiple key stages. So you'd be safe in terms of making comparisons and things like that with using those particular scales. But I would say to check out the Kindle scale, because that does have, it does have a version for Key Stage 1, but sometimes it's not applicable to use those, particularly in sort of early years.
Okay, thank you. Which questionnaire do you find that most schools do use?
Yeah, I just said it actually, the Sterling Children's Wellbeing Scale. It's definitely the most popular scale on our system. I guess it's probably because a lot of schools are new to the concept of measuring wellbeing, and that's a great place to start, whilst being really comprehensive as well. That being said, I think schools do tend to use a variety of them, depending on, I guess, ultimately what you want to find out and what you want to improve and the areas that you're focused in. We do actually find as well that the majority of schools create their own on different areas, I guess, being driven by priority and that kind of thing. I suppose that's why, we don't take a prescriptive approach as a company in supplying our schools with a set measure for them to use. The autonomy is there. It's up to them which ones they want to use. You can create your own and so on and so forth. But if I had to pick a front runner, if you will, then it's definitely the Sterling Children's Wellbeing Scale. Okay. That's actually it's actually a really good starting point as well if you're kind of new to this thing.
Fantastic. A question from Catherine. If a child has particular wellbeing issues, can the parents then be informed or involved?
Through our system?
Yes.
Yeah, our system doesn't facilitate for that, but we do have the ability in the system to run surveys either anonymously or not. So that means that if you want to, you can actually run a survey so that you can identify their responses down to the individual's level. So that would be able to, you'd be able to facilitate that conversation with parents if you wanted to thereafter, and if it was appropriate. So yeah, you do have that facility to do that in the app. Again, there's much debate out there about completing surveys anonymously or confidentially. I don't think there's anything that conclusive, to be honest, around this. I think that the perception is that if a survey isn't being run anonymously, then the individual will answer it differently. And I think in a lot of cases that is true, but I think in a lot of cases it isn't as well. I think it kind of depends on the type of survey, the questions being asked, and the context of it. So yeah, I guess we give schools the ability to run that in either fashion. So it's entirely up to them, how you want to organise that. In the same sense that if you were running a paper survey, it's up to you, whether or not you ask them to put the name on the questionnaire and that kind of thing.
Of course, yeah. Okay, great. Are there standardised wellbeing surveys for staff as well?
Yes, there are. We do have a couple that are preloaded onto our product as well. So there's a scale by Portsmouth University who we use, which is a really in-depth measure used for assessing quality of working life across educational professionals. So there's that measure, which is really well known and really well used as well. So there's benchmarking data available for that and that kind of thing. We also have a survey that's been produced by the What Works Centre for Wellbeing, which is a great sort of temperature snapshot based survey that's used for staff as well. So again, those surveys are available free of charge on our website. Okay,
great. Just had a question about links to the wellbeing staff surveys, so we can send those out. Great. When do your schools tend to run their surveys?
That's a good question. And I guess it varies, to be honest, school to school, and ultimately what that purpose is. You know, we get a lot of schools that will run once a term, for example, if it's that kind of snapshot or temperature check style survey. But I guess if it's something based around an intervention, then the kind of, you know, they might do it before the intervention's in place, midway through, and then at the end, for example. I guess you might get other kind of miscellaneous surveys that have been run. We also have content on the platform that looks at attitudinal data around attitudes to reading, for example. And actually there's some fascinating research that looks at the links between reading and the impact that that has on well-being. That's from 2018. You should definitely check that out. So I guess, you know, there are some often miscellaneous surveys that kind of run in between different interventions, and you know, there's sort of temperature check based surveys as well.
Okay, that's great. I think we might have cleared through all the questions. So I think, yeah, we're ready to wrap up. So thank you everyone for joining us today. It's been great to have you all here. And thank you also for attending the very first Governors for Schools conference, which has been running all week. As I said at the beginning of the session, we really would appreciate it if you could complete the short survey about how you found the session. This will pop up as you exit. As your feedback will then help us to improve on the sessions and hopefully enable us to deliver another conference next year. Finally, we'd be delighted if you could join us for the launch of our new campaign, All People's Every Ambition, which will be today at 4 o'clock. And you can sign up for this from our website in the same way you signed up for this session. And that will be talking about how governors can support the post-COVID recovery in schools. So on that note, thank you very much, Bob, for sharing your thoughts and experience with us this afternoon. It's been really, really helpful. As I said, we will follow up with an email on Monday and include answers to the questions that we haven't been able to answer now. And we can include a link to the staff survey as well. So thank you very much and have a good afternoon, everyone.